The Trump administration is recommending changes to childhood vaccines, and he's doing it through one of his many executive orders. So let's talk about that.
Order up.
This one is Executive Order 14407. It says it is the policy of my administration that federal programs and funding should support maximal parental choice over childhood vaccines. It goes on to recommend changing the early childhood vaccine schedule, decreasing it from protection against 18 diseases to 11 diseases. It also puts pressure on states to make sure their vaccine mandates are aligned with the Trump administration. But tonight, I want to zero in on one specific part of the executive order, one that shakes up a vaccine standard that's been around since the 1970s, MMR, measles, mumps, and rubella. The MMR vaccine combines all three. You get 2 shots, one when you're about a year old, another between 4 and 6 years old. This vaccine has essentially eradicated all 3 of these viruses until recently. Over the last 2 years, the CDC has confirmed 4,700 cases. That's more than the previous 24 years combined. The number of cases we saw last year marked a 35-year high. According to the CDC, this has been driven by declining vaccination rates and infected people coming into the U.S. President Trump wants to break up the MMR vaccine into 3 separate shots, and he's wanted to do this for a while. Here he is talking about it in September of last year.
The MMR, I think, should be taken separately. This is based on what I feel, the mumps, measles, and the 3 should be taken separately. And it seems to be that when you mix them, there could be a problem.
Fast forward about a year later, and you have this week's executive order. But why does the president want these shots taken separately? It all goes back to his administration's belief that there isn't enough research about the long-term effects of vaccines, specifically their belief that there could be ties to autism. Although there is no scientific evidence to support that skepticism, some people are still concerned about this. So there's an appetite for breaking up the MMR vaccine. We see it in our inbox. Mason wrote to us after our previous measles reporting. He wrote, "Why can we not get a measles-only vaccine, especially considering the other 2 viruses aren't causing the problem?" President Trump's executive order could make this happen. No other developed nation widely offers separate shots of measles, mumps, and rubella as part of a childhood vaccine schedule. They all use the combined MMR. The United States would be a test case. So how would it actually play out? I spoke with the Assistant Director of Public Health Policy for KFF, a health policy think tank. He says there isn't evidence that separating the shots makes things safer or more effective. And from a practical standpoint, it's more complicated.
It also introduces logistical considerations and hurdles. Parents have to take kids to 3 separate visits instead of just 1 visit, and you end up giving 6 injections instead of 2 injections. So all of that can add up to more cost, more time spent getting vaccinated.
Now, vaccines weren't always combined. In the 1960s and 70s, children got separate shots for measles, mumps, and rubella. Each vaccine for each disease had its own license. The first measles vaccine was licensed in 1963, mumps 1967, and rubella in 1969. In 1971, they combined all 3, the beginning of the MMR vaccine. And in 1989, the CDC changed its policy, recommending the 2-dose MMR vaccine. It was practical and safe. The skepticism popped up in 1998 after Lancet published a study about a possible link between the MMR vaccine and developmental disorders. This study, by the way, has since been retracted, and that's because after it came out, multiple research groups studied the same thing, and they found no causation. And those studies, by the way, looked at millions of children. The one in 1998 looked at 12 children. But the Trump administration wants more proof because, again, people are still concerned. So what now? There are no active licenses for single measles, mumps, or rubella vaccines. There's no strategy for the rollout or schedule, at least not yet. And since states set their own vaccine requirements, I reached out to NCDHHS about this executive order. They say at this time, North Carolina does not anticipate changes to our clinical guidance regarding childhood immunization. What do you think about all this? I know there are some parents who will see the ability to choose between the combined MMR or the single vaccine shots as a helpful option. And I know there are others who will see this as an additional layer of confusion. I want to get your thoughts in depth at WRAL.com.